Hey everyone, and welcome to PTCB Prep Guide. We're all about simplifying those tricky pharmacy concepts to help you ace your exam. If you're studying for your certification, you are in the perfect place. Today, we're diving into common respiratory pharmacology. We're going to cover key definitions, the medications you absolutely have to know, and some super helpful memory tricks for the PTCB exam. All right, let's jump right in. Here's our game plan for today. We're going to break down the most common respiratory illnesses you'll see on your test. We'll kick things off with the absolute basics, viral versus bacterial. Then we'll walk through over-the-counter treatments, some high-yield antivirals, and of course, the must-know antibiotics. And to make sure it all sticks, we'll finish up with a rapid-fire review session. Sound good? Let's get to it. Okay, first things first. We're starting with what is honestly the single most important concept you need to nail down. Getting the difference between a viral and a bacterial infection is the foundation for everything else we're going to talk about. If you get this right, the rest is going to make so much more sense. So, here it is, laid out plain and simple. On one side, you've got viral infections, like the common cold, the flu, or bronchitis. For these, antibiotics do absolutely nothing. The only treatment is to manage the symptoms. On the other side, you have bacterial infections, with pneumonia being the big example. These require antibiotics. For the exam and for your career, this is critical. Giving antibiotics for a virus doesn't work, and it leads to antibiotic resistance, which is a massive public health problem. Okay, so if antibiotics are off the table for viruses like the cold, flu, and bronchitis, what do we do? Well, the whole game plan shifts. It's all about managing those annoying symptoms, the coughing, the sneezing, the aches, and just giving the body's immune system time to fight off the virus on its own. So, what tools do we have in our over-the-counter toolbox? You've got to recognize these different classes for the exam. For a stuffy nose, we've got decongestants. For sneezing and runny noses, antihistamines. To calm down a hacking cough, we use cough suppressants like dextromethorphan. And to loosen up all that gunk in your chest, we use expectorants like guaifenesin. And of course, for the aches, pains, and fever, we've got our old friends acetaminophen and ibuprofen.
All right, I need your full attention right here. Pause what you're doing. This is a huge red flag safety warning, and it's a topic that comes up on exams all the time. You should never, ever recommend aspirin for a child or a teenager who might have a virus like the flu or even something like chickenpox.
And this is exactly why. The big risk here is a condition called Ray's syndrome. Now, it's rare, but it is absolutely devastating. It can cause dangerous swelling in the liver and the brain. This isn't just a test question. It's a critical, non-negotiable safety rule in the pharmacy world. Now, for most viruses, it's pretty much a waiting game. But there's one big exception: influenza, or the flu. For the flu, we actually do have a specific class of prescription drugs called antivirals. So let's take a look at the ones you absolutely have to know for your exam. And here's another huge point. Both for the test and for real life. These antiviral medications have a really narrow window where they actually work. To be effective, to actually shorten the illness or make symptoms less severe, they have to be started within about 36 to 48 hours after those first symptoms pop up. If you wait any longer than that, their benefit just plummets. Okay, these are your high-yield players right here. You've got to know the generic and the brand. Oseltamivir, which is brand name Tamiflu, is the one you'll see most often. It's an oral capsule. Then there's zanamivir, brand name Relenza, and the key thing to remember here is that it's an inhaler. Finally, we have baloxavir, brand name Xofluza, which is pretty cool because it's usually just a single-dose treatment. And here's a little gift for you, a memory trick that is going to be your best friend on exam day. Did you catch the pattern? Oseltamivir, zanamivir, baloxavir. That vir at the end, that's your shortcut. If you see a drug ending in vir on the PTCB, your brain should immediately scream antiviral. Okay, time to switch gears. We've been talking about viruses, but now we're moving into the bacterial world. We're going from illnesses that mostly just run their course to something that needs a much more direct attack: pneumonia. So on the exam, how are you going to tell the difference between bronchitis and pneumonia? This is your cheat sheet. Bronchitis is almost always viral, so you just treat the symptoms. Pneumonia, on the other hand, is usually bacterial. The key giveaways are a high fever and a nasty, productive cough. And productive just means you're coughing up mucus. This difference is everything because the treatments are total opposites. Pneumonia needs antibiotics. So, if pneumonia is bacterial and needs antibiotics, the next logical question is, which ones? Let's run through the list of drugs that are most likely to show up on your test. For this part, it's all about memorization, generic and grand names.
All right, you might want to screenshot this slide. Let's run through them. We've got amoxicillin/clavulanate. You'll know it as Augmentin. Azithromycin, famous for being the Z-Pack. Doxycycline. Then we have a couple of cephalosporins, cephalexin or Keflex, and cefadinir or Omnicef. After that, 2 fluoroquinolones, moxifloxacin and ciprofloxacin. And finally, vancomycin, which is a real heavy hitter used for serious infections, usually in the hospital. Get some flashcards going for these. Seriously, drill them every day.
Okay, deep breath. We have covered a lot of information. So now it's time to pull it all together and lock it in. Let's do a final, super fast review to make sure these key facts are fresh in your mind for test day.
Let's do a quick mental check. Are you ready to see what you remember? This is where we make sure you know the absolute essentials. Let's do it.
Ready? Let's go. The common cold? It's viral. You only treat the symptoms. The flu? Also viral, but more severe, and you can prevent it with the vaccine. Antivirals, those are your VIR drugs, are for the flu, and you have to start them within 48 hours. And the #1 safety rule you can't forget? No aspirin for kids with a virus because of the risk of Ray's syndrome. Got it? Good.
Next up, bronchitis versus pneumonia. Bronchitis, it's usually viral, so you just treat the symptoms. Pneumonia, that's usually bacterial, so you need antibiotics. How do you tell the difference? Remember, pneumonia comes with a high fever and a productive cough. And your job for the test? Memorize that list of antibiotic, brand, and generic names. Simple as that.
Fantastic job today. Seriously, you're on the right path to crushing your PTCB exam. So, what's next? First, go back over your notes. If anything felt a little fuzzy, just rewatch this explainer. And most importantly, make practicing those drug names a daily habit. Repetition is key.
Hey, if this helped clear things up for you, do me a favor and hit that like button, subscribe, and maybe share it with a friend who's also studying. We're putting out new content all the time to make this whole process easier for you. Keep up the great work. You totally got this.